Welcome to this edition of the CINECA webinar series, where Melanie Goisau and Emmanuel Rial-Sebag from BBMRI ERIC and from INSERM Toulouse University will present the case of data reuse, ethical, legal, and societal issues in international genomic data access and sharing. My name is Marta Llorell Linares, and I'm involved in the CINECA project on behalf of MBLBI. I would like to make you aware that this webinar is being recorded, and this recording will be then available on the CINECA website and YouTube channel. We have reserved some time at the end of the session for questions from the audience. So if you have any questions, please write them on the Zoom Q&A panel. I'll briefly introduce you to the CINECA project. CINECA stands for Common Infrastructure for National Cohorts in Europe, Canada, and Africa. And it's a 4-year project that is funded by the European Union's Horizon 2020 Research and Innovation Programme and the Canadian Institute of Health Research. CINECA's vision is to accelerate disease research and improve health by facilitating transcontinental human data exchange. And to achieve this, CINECA is working on a series of challenges. The first one is federated data discovery. So how, as a researcher, you can find cohort data of interest. This could be for a specific genotype or a specific phenotype, for example. And then once you find the data, you will need access to it. So CINECA is working on an interoperable authentication and authorization infrastructure. And once you get access to the data, if you want to ask research questions across cohorts, there will be a need for a harmonized cohort-level metadata. The ultimate aim of CINECA is to enable federated data analysis in research and healthcare. So CINECA is working with a set of demonstrators across cohorts in both clinical and research settings. And above all these challenges, there's a fundamental need for an ELSI framework to address the ethical, legal, and societal issues. CINECA also has an outreach and training program to increase awareness and capacity building in these areas. I'll introduce today's presenter. So Dr. Melanie Goisau is a social scientist and holds a doctorate in sociology from the University of Vienna. She also studied at the Royal Holloway University of London and is a graduate of the postgraduate program Sociology of Social Practices of the Institute for Advanced Studies in Vienna. Her dissertation was awarded the prize for best thesis in 2017 by the research network Gender and Agency of the University of Vienna. Since 2008, she works as a lecturer at the Department of Science and Technology Studies and the Institute of Sociology of the University of Vienna and at the University of Malta. Currently, she is senior scientist at the European Infrastructure for Biobanking, BBMRI ERIC. Her research focus is on ELSI issues of biobanking, in particular on governance and stakeholder engagement, as well as gender, knowledge production, and artificial intelligence. Emmanuel Rial-Sebag is a lawyer, graduate in health law and PhD in health law. She is director of research at INSERM in health law and bioethics. She's the leader of a multidisciplinary team, bioethics, at the INSERM Paul Sabatier University, CERPOP unit in Toulouse. She's an associate lecturer in biolaw and bioethics at the University of Medicine in Toulouse. And she's currently developing research on the governance of research in biotechnology and the role played by regulations at national, European, and international level: genetic testing, genomic and health data protection, biobanks, stem cells, epigenetics. And at this point, I'll hand over to Melanie.
Thank you for giving us the opportunity today to present our research outcome and our work within the CINECA project. And the focus today is, as mentioned, on the ethical, legal, and societal issues within international genomic data access and sharing. So our focus is on the question of how to share health data or genomic data in particular. And as I guess most of you already know, is that health data is collected in cohort studies, and all these data together are valuable sources for knowledge generation and very important for biomedical research. As this data is often collected within these cohorts and then used for several research projects, which goes often beyond the initial purpose where this data were collected, this raises several questions that has to do with the ethical, legal, and societal implications and the sensitivity of, in particular, genomic data, especially in the context of vulnerable and ethnic groups. For data sharing, the FAIR principles has become the principle to do so, but are more on the technical side. And there also has to be already attempts to enlarge this notion a little bit from fair to fairer, also to include ethical and reproducible in this set of principle. And along these lines, also the legal and socio-ethical considerations are equally important for a data sharing ecosystem and for further uses of genomic data. So within these frameworks, IT solutions need to be embedded in a governance framework that adheres to these ethical and legal standards as well as to societal values. In today's webinar, we want to address some challenges and also provide some recommendations that would help you further to deal with all these questions, especially regarding the access or reuse or further use of health and or genomic data in the scope of CINECA from the ELSI, so ethical, legal, societal issues perspective. And we want to focus on 4 main areas. First, safeguards and respect for privacy. Second, engagement and benefit sharing. Third, informed consent and further use of data. And fourth, further uses and data access. And we want to conclude with a brief outlook of upcoming developments, especially in focus of synthetic data and artificial intelligence. Our work is based on, so to say, some co-creative and engagement activities within the CINECA project. So our focus was on identifying ELSI aspects and gaps in data sharing between Europe, Canada, and Africa, which is like the broad scope of the CINECA project. And finally, also to provide recommendations that would help to set up a good governance framework. And we did so in organizing several workshops with key stakeholder groups, for instance, patient representatives, also African stakeholders, technical experts from within the CINECA consortium, and also to have the recommendations we will present later, also formulated in a way that's really practical for these groups. And until now, we also gave some webinars on all these issues. So a webinar on these key gaps and ethical and legal issues. Also on the process of developing a code of conduct. We also address the topic of fair to fair, so from fair principles, but also fair in terms of fairness in the data sharing, also ELSI issues in merging data, and today's webinar on access and sharing in particular. I will now start with the first topic, which is about safeguards and privacy, more from the perspective of the ethical and societal perspective, in particular, as CINECA is involving vulnerable groups and also ethnic groups. And this raises, as I've mentioned before, some important questions about how to use this kind of data. Because as we see with, in particular, genomic data, there are some risks that needs to be addressed, especially in the context that this data is used in multiple ways and shared across countries. and this could result in some or potential harms related to the protection of privacy. I mentioned here a paper that should be published very soon, where we address these issues when it comes to genomic data sharing, especially the question that is, so to say, beyond the legal scope. So when it's not about like the misuse in the legal sense, but also in particular uses that could be harmful for specific groups and the implications around that. And in that regard, or the question that has been raised is if anonymization, which is so far seen as a minimum requirement to protect research participants, is still enough or appropriate when it comes to genomic data, because it already has been shown in some studies that there is a risk that data can be matched with other kinds of data sources, and research participant could be re-identified. What we observe now is within the technical infrastructures and the possibility that research brings, especially in the genomics field, we observe that there is also a risk, so to say, in a change in the risk profile, especially when it comes to the question of potential re-identifiability, but also stigmatization and discrimination, as this genomic data is not only giving them information or insights into into individuals that participated into research and gave consent to do so, but could also use to make some conclusions on the group level, so that the harm itself is not then a topic for the individual, but could also be a risk for groups. So what we want to make you aware of today is that you do not need to learn all the aspects we are raising today, but we want to make you aware that you are dealing with data that is sensitive, and that you have to remember some of these aspects and act based on that. So it's not only about kind of the rules and standards that you need to follow, but also reflect on the practices in how to do so, and in order to use the data in a fair and responsible manner, especially when it comes to genetic data, and also to have a good governance structure in place and a good way to manage the data. In the context for CINECA, we are also dealing with data from low and middle income countries. And there it also already has been noted that when it comes to broad consent, additional safeguards should be in place, which means that also the engagement with the community should be included in the research process, and to address especially this question of potential re-identification, benefit sharing, and commercial uses of research results. This also goes back in that context to a background of a history of unethical use or misuse and commercialization, for instance, of African genetic data and material. And in order to act more responsible, this should be included in a good governance structure. What we also see are new developments in the genomic research fields, for instance, when it comes to polygenic risk scores. And this type of research then shed new light on some existing ethical, legal, and societal issues when it comes, for instance, to incidental findings, the relevance of results for family members, the determination of health risk, and access to the topic of risk stratified care, and the representation of various groups also to represent genetic diversity. We also want to point to some tools where you can find further information, and you can use the QR codes on the slides to go directly to the websites for the question of safeguards and privacy, for instance. the GA4GH Regulatory and Ethics Toolkit, and you can also find relevant material and links on the BBMRI ELSI knowledge base. So the recommendations we want to give is to implement respective mechanisms and safeguards to ensure privacy and to protect research participants. Also to maximize the potential and to promote the development of technology, while at the same time protect the privacy and security. So it's always balancing what you can do and should do in both ways, and also to implement monitoring and evaluation mechanisms, which is for instance, track the chain of data access, have a continuous ethical review process in place, also be aware of changing conditions, for instance, the change in risk profile I mentioned earlier, and also assess benefits and risk of harm of data sharing, and also think about how to mitigate risk and establish mechanisms for handling complaints and related to data misuse. The other topic I want to mention is the stakeholder engagement. As you already heard, that the further processing of genetic data raises all these questions, and I already mentioned that it's important to include groups where the data is used that could be sensitive or could have a harm on certain groups. And so engaging the stakeholder groups is very important. And what we saw from previous research is that there is also a need to inform, and this was voiced by kind of both sides, so research participants and researchers. So we saw in previous studies that research participants want to have a say in how their sample and data that are used, to what extent and how is then dependent on the situation and on the possibilities. But the need is clearly identified in research, and we also saw in a survey conducted by BBMRI shortly before the GDPR kind of was there, and made some of these issues a requirement that also kind of the professional said there is that the practice around informed consent needs to be improved, and also participant engagement is something that there should be improvements. So speaking about stakeholder engagement in research, I also want to reflect a little bit on the stakeholder engagement we did within the CINECA project with the stakeholder groups mentioned on the left-hand side. And some key findings were the need for the protection of research participants whose data or personal data are shared, and also to protect them from misuse and exploitation. So this was also not only in the literature, but also among the stakeholder groups, a key or a very important topic. And also to reflect on informed decision making, so also informed consent in the relation of now what we have in today's research practice, a multiplicity of stakeholders, research settings, regulatory bordering, cross-national data sharing, various healthcare systems, further uses or future uses of this data. And as mentioned, also the engagement with patients or community to discuss potential risks and how to address them, and also how to mitigate them, especially also when it comes to benefit sharing and the commercial use. And it's also important to address the conditions for an equal partnership, for fairer. You see already in the wording that to be fair is already a complex topic. So for a fair sharing of data, research outputs and benefits among all involved stakeholders. Again, where you can find, where you can go to find more information and resources. We have a previous CINECA webinar on the ELSI issues around fair data sharing, the GH4GH Regulatory and Ethics Toolkit, and you can also find more information on the BBMRI ELSI knowledge base. I want to highlight here also some resources around minors engagement, for instance, biobanking with children, also as a vulnerable group. And when it comes to stakeholder engagement, some recommendations. So, for instance, encourage common policy and procedures that minimize the barriers to share data, but again, while protecting the privacy of research participants and ensure data security. Ensure also training and skills development around privacy and security measures, and facilitate engagement and participation of a wide range of stakeholders already at early stages of the research process, not just at the end, but also when decisions are made and so on, so that to ensure that this is included from the very beginning, and also consider the ethical, legal, and societal implications for the establishment of a good governance structure, and also think about data access that is governed by data access agreements and the involvement of data access committees. And with that, I hand over to Emmanuel.
Thank you very much, Melanie, and good afternoon, everyone. So I will start by presenting or recalling very general considerations regarding GDPR. Of course, we have already developed all these issues in the previous webinars that we have presented in a more technical or legal and detailed way. So here, these are just the main issues that I would like to recall for today. So the GDPR has two main goals, and I would say that the second one is usually forgotten. So of course, the first one will be to protect the privacy of individuals from whom the data, the personal data, but because here we are only talking about personal data, which are those that are able to identify individuals. So the first goal of the GDPR is clearly to protect the privacy of these individuals from whom the data are collected. And what means protecting privacy? It means to allow and to provide some rights, some personal rights that are rights to information, to be informed of what's going on with your data and what is going to happen to your data. The right to access, to have access to the data, to rectify them, to erasure them, data, to restrict their use. The right to data portability, which is not a full right. This is only applicable when the data are processed under the consent, and also to object to the data processing. So these are the main rights, as you can see. Consent is not part of that, and we will come back to that, of course, right after. So the second goal of this regulation is also to offer a secure single space for data exchange in Europe and beyond, because there are associated also members that where you can exchange with whom you can also exchange your data freely. And the idea behind that is really to make the kind of single market of the data and to ensure that the data could also be exchanged freely between the different labs or the different research teams. Again, this is really important to have that in mind, because usually GDPR is seen or presented by researchers as a kind of blocker to the research, which is not really the spirit of the GDPR. And my idea for today's webinar is again just to sensitize you to the spirit of the GDPR and not so much to go into the very technical details where all not the lawyers are in agreement first. So there are much space again to interpretation of the GDPR provisions. So the idea is really to sensitize you to this kind of spirit of GDPR, and this is one of the spirit of the GDPR is really to open the data and to ensure their free circulation in Europe. Another short reminder about genetic data that are part of health data in terms of legal regime. And health data and genetic data are considered as sensitive data. And the first provision in the GDPR in this regard is to prohibit their processing. And we all know that this is not possible not to process them in terms of medical care or also in terms of research. But that means that if you want to process genetic data and health data, you need to respect two main conditions. The first one will be to ensure that the data processing is lawful. And then you have to look into Article 6 and to find what is the best legal basis on which you want to process your data. And as you can see, I have not put all of them there in bracket. I have only put those that can be relevant to health research. Consent is one of these legal bases. That means that this is not always on the basis of consent that the data are processed, and we will come back to that. It can be also under another legal basis, which could be usually public interest or vital interest if you are in the medical field. So after choosing this first, it will be the first step to ensure that your processing will be lawful. Then the second step is to ensure that you are falling under one of the exceptions of Article 9, one of the exception of the prohibition to process health and genetic data. And again, under Article 9, you can find explicit consent, vital interest, substantial public interest. So again, here consent is only one of the possible legal bases. And here what is important also is to see and to know that for scientific research, this scientific research can be also one of the exceptions, which means that if you are basing your processing on this exception of scientific research, you would not need to have a formal consent, informed consent, specific consent. Next, please. So if we come to the informed consent question, first, I want to recall something which is usually mismatched when we are talking about consent, is the consent for data processing and the consent for research. So those are falling when you are performing a research on human or on biological samples, you are falling under one specific regulation, one specific framework, which is aiming to protect the human body, its integrity, and what you're going to do with the biological elements. And there you have a very, very specific provisions to be respected in your national laws, at the international level, also through different legal instruments or recommendations. This has to be separated, or this has to be distinguished from what is expected or what is required under the data protection regulation. There we are talking about only data processing, and the consent for data collection is only something which can be required, but it is not an obligation to get this informed consent for data processing. Although this is fully required when you are performing a research, you need to have an informed consent from the individuals. So this has to be very clearly distinguished. And I put here a reference where you can have also additional information in this regard. So the consent, coming back to the data processing, consent is only one of the legal bases for data processing in research. It can be this one, but it can be another one among those that I have presented already. But again, I think, and this is coming back also to our main message for today, that the law cannot be fully separated from the ethics, cannot be separated from the social issues. I think that we can have also a vision, a more global vision. Consent is not only a legal requirement, it's, I would say, mainly an ethical requirement. And this consent from an ethical point of view can have also a role to play into the data processing, into the genetic data processing. And this is what is recalled in the GDPR in its recital 23, where there is a possibility to modulate, for example, the informed consent, to make it broader in order to also ensure that all the purposes that have not been identified at the very beginning of the data processing can also be embedded in the process and in the data processing compliance. So GDPR also refers to this informed consent as an ethical requirement, and we will come back to that again. Next, please. So in practice, just to summarize a little bit what I just said, the consent can be mandatory for the primary collection, and this can be mandatory if you choose it under GDPR requirements, or if your national law, because here I have to recall that in the field of health and in the field of health data and genetic data, member states can have also their own regulation in this regard. So that means that they can adopt stricter provisions to protect and to ensure the privacy of individuals. So you will have to have a look also to your national regulations and to your national laws. So under some national laws, this is the case in France, for example, for the primary collection of genetic data, you need to have an informed consent in writing, for example. But according to the GDPR, again, this is only one of the legal bases that you can use. And if you use the consent as a legal basis for the primary data collection, this consent should be free, specific, informed, and unambiguous. Regarding I would say the governance and what is usually proposed by the national authorities for data protection, they are not recommending to use consent as a basis for this data processing. They are usually proposing to promote more the performance of a task carried out in the public interest or the legitimate interest as a legal basis for the data processing in health and in research. Next, please. So when we try to match the question of informed consent and how it works for further use, because you know that you have to apply certain rules at the time of the primary collection, but you have all the kind of rules and other set of rules when it comes to the further use, which is the term which is used in the GDPR. So first, further use means, from the GDPR perspective, processing of previously collected data for a purpose different from that originally intended at the time of the collection, of the data collection. And then we need to have a look to three elements which are needed to know what to do in terms of further use regarding the informed consent. First, there is a presumption of compatibility between the initial use and the further purposes. And this presumption of compatibility doesn't mean a full authorization to reuse the data the same way that you have collected them at the first time. I mean, this is not a full authorization. That just means that this is supposed to be compatible. So it is under the shoulder of the person or the group who will reuse the data to ensure that the purposes are compatible with the initial data collection. And if it is the case, so this is a risk-benefit assessment that has to be done by the data, the responsible of the data, the data controller, let's say. And in that case, we suppose that there are no additional procedure to be done in regard to the data processing. That doesn't mean that you do not have any additional procedure to do in regards to the research provision requirements. So again, this has to be very clearly distinguished, what is needed from the data processing perspective and what is needed from the research perspective. Then the institution or the DPOs usually need again to assess whether in this specific situation there are appropriate safeguards. So again, this is a risk assessment which is on the shoulder of those who are going to reuse the data and to further use them. Regarding these appropriate safeguards, what is usually mentioned in the GDPR is the pseudonymization or the minimization of the data. And the third items that you need to look at is really, do you have any specific requirements under your national law? And this is very important again, because usually, and this is something which is quite classical for genetics, the competency really relies on member states. So usually you can find some very specific provisions in your law, in your national law, and if it's more protective of research participants, you will have to apply them. Again, consent can be considered as one of these additional safeguards. If not, I would like again to say that even though you are not processing data on the basis of consent, the right to information is still there. You always need to inform the individuals that you will reuse their data, even though you are not going to formally gather or get their consent back. This right of information is always due. Next, please. So again, and in order to match this legal with the more societal question, I think that again, the reuse of the data should be seen as a topic from a societal point of view. And you need to ensure that there will not be any possibility to misuse them or to ensure that appropriate safeguard will be put in place to ensure that they will properly used according to the goals that you have already, or the objectives that you have already identified, and the purposes, of course. The second point that I would like to raise here is that this reuse of data or further use of data involves several stakeholders, and this has consequences because the way that you this requirement of consent is seen from the researcher's perspective, or from the research participants' perspective, or from the institutional perspective is very different, and this has to be put all together to ensure that the data will be properly reused and will not lead to harm again, or to discrimination or to misuses. And then you have some information in the results that have been produced through the study Your DNA, Your Say. There are also specific considerations that needs to be faced regarding the participation of individuals from low and middle income countries, and this has already been mentioned by Melanie. And again, I know that you all know that in the area of genetics, the technologies are evolving a lot, and that we are producing more and more data because we are the technologies give this possibility to have this kind of big data producing big data and at a large scale, and this is maximizing also all these risks, and this has to be taken into account in the way that you're going to reuse the data. If you are using big data techniques, it has also to be done in a very careful way, if I can say it like that. Next, please. So, as previously mentioned by Melanie, we have also several tools that could be useful for you to have access to solutions. We have provided previous webinars, again, on the international data sharing. There is this GA4GH regulatory and ethics toolkit, and again, the BBMRI-ERIC ELSI knowledge base. Next. So the second point I wanted to raise, oh, sorry, this is the recommendation. These are the recommendations. So the recommendations on informed consent and further use is first, and this is really my position, that more than consent, what is very important is the information, and what you will be able to provide as clear information and information as a process regarding the reuse, the further use of the data. So I think this is really the challenge. For me, the information process will be the challenge. So you have to inform on what's going to happen to the data and how they will be used, how they will be handled, how if they will be transferred. All these issues should be part of the initial information and also of the information for the further use. And of course, there is this need to inform people that they have the right to opt out or to withdraw, and sometimes to have access to the return of results. This is not always possible. And if it is not possible, you can mention it in the information document, and you have to explain why this is not possible to return the results. And of course, there should be always the information on who can I contact to make my right effective. For example, if I want to access, who do I need to contact to ensure that I will have access to that? So in the information document, you need to provide the name, or you need to provide the procedure to have access, for example. You have also to provide let's say, some procedures or good practices around informed consent and appropriate alternatives. First, again, this is a process. So this is the continuous ethical assessment, including for the further use. So you need to revise your document if you're going to use an informed consent, of course. My, again, message would be that more than just a legal requirement, this is an ethical requirement to ensure that people have fully understood what is going to happen to their data, and also to give them the possibility to withdraw. So this is really, for me, to ensure the respect of fundamental rights. You need to assess the risk related to future use and data sharing in various countries, because as in CINECA, we are acting not only in Europe, but elsewhere. This is an international scale. So, I mean, not only GDPR is applicable, you have also other types of policies and governance practices elsewhere. And also you need to take into account the specificities of the population, and to ensure that there will not be, the data will not be re-identifiable. So this is you have to put in place all the technical and security measures to ensure that this data will not be re-identifiable, and to avoid any stigmatization of vulnerable groups. And again, the last recommendation is one of already mentioned by Melanie, is to seek for the level of acceptability of consent, notably in low and middle income countries. Next, please. So regarding the further use and the question of data access, I have really summed up a lot on this slide. That again, what is the spirit of making cohorts at national levels? It means to provide a resource for the scientific community. So by definition, this resource has to be shared, and it has the objective to be shared, and for various purposes, which can be very different from the initial purposes. So in this context, Of course, researchers have several duties towards research participants. Again, the respect for their privacy, to avoid the misuse and to ensure the data integrity. But the researchers or those that are building the cohorts have also to implement governance procedures and governance mechanisms to ensure that the data will be properly used and ethically used in a responsible way. And they have also to provide the procedures to have a clear access and equitable access to the data. Next, please. So to that end, different tools are again accessible. So we have one webinar that was provided on the status update of the Code of Conduct. And you have also the GA4GH Beacon project where you can find information. In terms of, next please, sorry. In terms of recommendations, you will have to ensure that the data in the catalog are updated. You will have also to implement clear procedures for the assessment of the data users protocol through, for example, the appointment of a data access committee. You need to review and have approval procedures for the use of health and genetic personal data for research. Again, you have to have a look to what is expected from your national laws and to rely on the compatibility principle that we have already seen. The last recommendation will be to increase the transparency through public information mechanisms while respecting health genetic data confidentiality and legitimate interests. Next, please. So as an outlook, we wanted just to highlight two main points. The first will be on synthetic data. We know that in CINECA, the main goal will be to provide this kind of data sets of synthetic data. And usually this is presented as avoiding all the questions that are related to GDPR because they are considered like anonymous. So I'm not fully sure of that affirmation, because I think that for sure for the primary collection we still need to respect all the GDPR requirements and need to protect the privacy of individuals. And if you want to transform this data in synthetic data, maybe you should also say that in the initial collection of the data. So I'm not fully sure that all the GDPR will be just out for this synthetic data. And I wanted to say also that from the statistical point of view, we have remaining ethical questions that the results could also lead to discrimination or stigmatization. Even though you are not processing personal data, the results can also lead to this kind of issues. So you should have that in mind. And regarding artificial intelligence, we know, and we are all working on these questions as of today, that we will have new additional questions regarding AI and its use in research activities, with regard to informed consent, to is it increasing or not the risk of data privacy, how to protect the data into this AI context, what are the questions related to further use, governance, and so on. And I wanted to end up this presentation by saying we are not expecting from you that you are becoming lawyers or experts in ethics. Our main message, again, will be that you will be in capacity to identify or formulate ethical questions, and that you have also the possibility to gather some information through the different tools that we have presented today. And even if by the end you still have questions that are very technical questions, please have a look in your environment, in your institution, to find out who could be the relevant person to help you in your institutions, in your structure, as DPOs or legal department. And you have a QR code there where you can find additional guidance coming from the BBMR ERIC. Last. So thank you very much. I would like also to thank my collaborators, Lisa Ferriol and Pauline Rateau, in preparing this presentation and ready for your questions. Thank you very much.
Thank you very much, Melanie and Emmanuel, for this presentation. There are already a few questions in the Q&A list. And of course, if anyone has any more, we still have a little bit of time, so you can add your questions there. So the first one says to Emmanuel, when you mention consent as safeguard, you made reference to consent as ethical requirement and not consent as legal basis, i.e. data processing consent under Article 6 and 9, right?
Yes. So I have to read the question.
Yeah, you can
yes,
open it.
Because it's a kind of...
Yeah.
This is Ilaria. Yes. When you mention consent as a safeguard, you might remember consent as ethical requirement. Right. That's right.
Okay.
Technical question coming from a lawyer. So.
So the next question.
Thank you for the question, Ilaria.
The next question is, you mentioned that there is still a lot of space for interpretation with GDPR. Is this possibly a disadvantage as each country institution have different interpretations and therefore it can take a long time to reach agreements between partners? Talking about why researchers see GDPR as a blocker.
But you're right. I mean, there is this question of the discrepancies or the differences between the EU regulation and in their interpretation in the different national countries is still a problem. But I mean, I'm not sure that we will have and we will reach any agreement, because questioning genetics is also a kind of cultural question. This is not just only a legal question. This is also how you see or how your national or your state is also viewing the questions regarding genetics. So I think that reaching an agreement will not really be possible, except what should be possible is that we will have some guidance from the European Data Protection Board that could help. And this is expected also to have something on research. So we will have a kind of guidance on how to interpret and how to apply several these questions regarding research and the different provisions of GDPR and how to interpret them. So I think that we will have a guidance there. And maybe also there are rooms for the different data protection authorities to have a dialogue on how to interpret these provisions. So I think that there are still rooms where we can find solutions. But except that, I think you're right, there is a kind of jeopardization on how it is interpreted.
Thank you, Manuel. So the next question is, I have a question toward EHDS regulation. What is the future of informed consent in a light of the new regulation coming? I heard mostly about opt-out ID application to data usage, which I understand as if I don't opt out, the health data access body or PI of a project having my data will decide on behalf of myself to where my health data can go. Thank you in advance for your insight and opinion.
I think that I will not be very helpful on this European health data space thing regulation, because first it is not adopted, and you all know that since the regulation is proposed until it is voted, it can change a lot. So I think that my impression is that the opt-out system is what is the principle for health data. So we need to incorporate this thing, because regarding health data processing, usually when you are going to your medical doctor, you're not giving a formal informed consent. I mean, for the data to be processed, you have only an opt-out position. And this is the same usually in research. except in several countries where it is required to have an informed consent for data processing in genetics. So, I mean, the opt-out is usually the rule. So how it's going to match with what is going to happen in the European health data space, it will depend first if we are talking about the data to be used for your care, or if we are talking about the data that to be used for research. And then I think that there are several projects currently that are trying to map out what could be the best solutions to be adopted towards this European health data space. So we do not have rules that are adopted yet. And my feeling is that it will be more the opt-out system, but with additional safeguards. Again, I mean, the spirit of GDPR and probably the one of the European health data space is that consent is not the only way to protect privacy. So you can have opt-out systems if you have good governance, transparency, good practices, additional safeguards, then you can also fit with what is expected to protect privacy. To go out a little bit from the consent, one size fits all.
Thank you very much, Emmanuel. So we are very close to the hour, so I'll just take the opportunity in this last couple of minutes to advertise the next event that CINECA is organizing. So we are organizing a workshop on federated data analysis in Cape Town in South Africa that will run on the 26th of February in the afternoon there in Cape Town. So if anyone is interested, you have the QR code here, or you can go to the CINECA website and sign in there. So this is gonna be it for today. Thank you very much, Melanie and Emmanuel, for your presentation. And thank you very much, everyone who attended the webinar today. See you next time.
Thank you very much.